Welcome back to Midday. We've got Dr. Bob Rishiraj joining us, an oral and maxillofacial surgeon who is always on the show every month, and we love having you, so thanks for coming back.
Thank you very much for having me.
We're talking about different topics every time you're here, Dr. Rishiraj, but today it's all about corrective jaw surgery, and there's another name for that as well, isn't there?
It's orthognathic surgery. Ortho meaning normal,
right.
Gnathic meaning jaw.
Okay.
So the surgery basically involves either one jaw or both jaws. The correction is done in all three planes. So in the anterior posterior plane, in the transverse plane, and then up and down. So you will sometimes see people who have jaws that are very prominent, such as this. So basically there's a workup that's done, and it's to assess which jaw has overgrown and how we can compensate.
Is this what you're talking about?
That's exactly it. So that's one of the common procedures or common patients that we can see where their lower jaw has grown to its normal position, where the upper jaw has not. So it's basically called a deficiency. So in this case, when we look at the patient from a profile view or the side view, what we really see is the patient's upper jaw is very, very short in the anterior posterior plane. But when we turn, so what we are able to do in our offices now is we have softwares where we can actually take, if you look at the schematic on the left side, that is the patient's actual upper and lower jaw.
So that's the original.
That's the original.
Without being corrected.
Correct. Okay. And then what's basically done is we plan the surgery pre going to the operating room, and we can say, okay, we're going to move that upper jaw forward.
Right.
In this case, it was, I think it was about 7 or 8 millimeters.
Wow.
Even that wasn't enough because there's a limit to how much you can move a jaw.
Right. Yes.
Right, because of the blood supply. Blood supply is very critical. And so if you don't have enough blood supply, everything can basically necrose or die.
Right.
So here is the same patient.
Oh, this is the same patient.
Same patient
so this is her
after surgery.
Amazing.
And you can see the big correction that has occurred. Now,
really good.
In this case, not only was the upper jaw done, but the lower jaw had to be set back a little bit.
Because you couldn't put the top as far ahead.
Correct, you can only go so far, and then there's a limit. And then you go, okay, what can we do to compensate or to make the occlusion, the bite proper, and also make sure that the patient has good aesthetics? Because aesthetics comes with the patient having the surgery. The main thing in this surgery is occlusion, proper bite. Because the majority of these patients like this have never bitten into a sandwich. They just can't.
Wow.
Right? They do this surgery, about 6-8 weeks later, they're into a normal diet. So it makes a very big difference.
In your whole lifestyle, really, right?
It does. Not only does it gives them a lot of self-confidence. That's one of the biggest things that we hear from patients. When you talk to them after the surgery, they say, you know what, it's tough. It really is. You know what, first 24, 48 hours, it's tough. Especially if we're doing the upper jaw. It's a major surgery. You're moving the whole complex, upper jaw forward, lower jaw forward or back. So, but most people complain about the upper jaw more, just because the sinuses are plugged up. They just don't feel well that night. But then, you know, as the body starts to heal, within 24, 48 hours, they start feeling better. And most of these people go home after 24 hours.
Wow.
It's major surgery, 24, 48 hours sometimes they'll stay, but most times 24 hours they're gone.
So, Dr. Rishiraj, so you say it can improve chewing or your bite, so you're chewing, but anything else? I mean, what about speaking and things like that? Speech
definitely changes in these patients because they literally have to learn how to speak again, especially in a patient that we just saw where the movement of the upper jaw is so extensive. The other thing that they have in this case is their breathing improves. Because the amount of airway space that they have in the back is very constricted. You move the jaw forward, even the lower jaw, all of a sudden they go, oh, I can take a breath and I don't feel like I'm being obstructed. So that's another very, very important thing. It's actually the most definitive surgical treatment done for sleep apnea.
Really?
I have done this for multiple patients. They don't use a CPAP machine. They sleep well at night, and they don't have any sleeping issues during the day, because that's one of the big things with sleep apnea is during the day they just want to fall asleep.
Yeah, but
right?
that goes back to what you were saying then, is that this is, yes, it aesthetically, you know, you can improve the look there, but it's also changing your whole lifestyle. That's improving your health everywhere, sleeping, eating, everything.
Yeah.
What can be sort of the long-term effects? We only have about a minute left here, Dr. Rishiraj, but what could be the long-term effects if you don't have that corrective jaw surgery?
Well, I think the biggest thing is health-wise is the nutrition. Nutrition is quite compromised in these patients. Airway issues become, you know, as we get older, most of us gain some weight. And if you already have a compromised airway, sleep apnea starts to become a dominant factor. And having good health with good nutrition makes, you know, a lot of sense for multiple patients. And most of them say that was the best thing they ever did. So yeah, it's aesthetically it comes just with the surgery.
But there's a lot more to it.
Yeah, but the primary function of this surgery is function, improved function.
All right.
Okay, so
great. Well, that was interesting. That's fascinating, really, Dr. Rishiraj. Thank you. For more information, you can visit the Kamloops Oral Surgery Clinic. The website there on the screen and the phone number if you want to get a hold of Dr. Rishiraj. We're back in a moment. Stay with us.